right, welcome, good morning, good afternoon, wherever you might be, to everyone who's joining us. I'm Grace Rubenstein, Editorial and Communications Director with Health Begins, and thank you so much for joining this webinar, which could not be more timely as we make our way through this stage of the pandemic, through this stage in our work toward health equity and justice, and as we approach this season of reflection near the end of the year. This webinar is titled How to Walk the Walk, Caring for Ourselves and Each Other on the Path to Equity. We have some really wonderful presentations and discussions in store. Just before we start, I want to let you know that this webinar is being recorded, and we will share the recording with you via email after the webinar. Also, please know your lines as participants are on mute, but we really want this to be a dialogue. So we'll have a very active chat throughout. And if you have any questions for us, you can enter it at any time into the chat window. I'll be keeping an eye on that, as will Rishi and the rest of my colleagues. We might want to do just a little practice right here, getting the chat going. You'll see that you have a drop-down menu and options of who to send your chats to. Let's make sure you choose that you're sending them to everyone. And you could just say a quick hello and where you're from. We would love to know. All right. I am in Alameda, California. Nice to see you. So this presentation is going to last 1 hour. We'll have time at the end for question, answer, and discussion. And with all that, it is my honor to hand it over to Health Begins CEO and founder, Dr. Rishi Manchanda.
Thanks, Grace. Can you guys hear me and see my screen?
Yeah.
Great, thanks. Grace, thank you, and thanks everybody for joining us today. And Grace reviewed some of these reminders here. So again, want to underscore the last sentence on this slide here, and particularly because I am incredibly grateful for the presenters that we have joining us today, and obviously for the topic at hand. So as we move ahead, that's me. We want to just review some of our objectives for today. We had shared in the invitation for this webinar, for this conversation, these learning objectives, and to voice them over at a high level. We're hoping that by the end of this conversation today, you'll be better able to describe the need, the urgency perhaps, for caring for ourselves and for each other on this path to equity. And as importantly, be able to list at least a few examples, or at least a couple of examples of ways in which mission-aligned organizations are creating space for resilience, rest, self-care, even joy, and then to be able to identify at least one resource or step or idea that you can use to be able to better care for yourself and your team and your colleagues on this path. So those are our kind of formal objectives, and the reason I'm really confident we'll meet them is because of the expertise and the wisdom of the presenters that we have joining us today. You're going to hear soon from Taylor Goyette-Frichette, Patricia Avila Garcia, and Cynthia Salmi. You see the organization affiliations here. Having had a conversation with all three of them last week as we prepared for today, I have no doubt today is going to be a really engaging dialogue. And again, my gratitude, deep, deep gratitude to each of them. Before we proceed in the order you see from left to right with our presenters today, a little orientation to Health Begins for those who don't know us and are joining us today for the first time. We're a national mission-driven organization providing consulting and training services. Our core mission is to drive radical transformation in health equity. And the way we do that is to be able to help our clients, our partners, to be able to improve the social and the structural drivers of health equity, social needs, social determinants, structural determinants, for example. That's our mission, as I just voiced over. And when we talk about that bolded element at the bottom, the structural and social drivers of health equity, as with many of you more and more these days, we mean something very specific by social and structural drivers. For us, for the past almost 10 years, we've been defining this work using the shorthand phrase of moving upstream. That is not just a generic term. We actually use it very specifically to mean the continuous improving of social and structural drivers across all three levels of work. Individual, by improving individual health-related social needs, improving the community level social determinants of health that shape those needs at the individual level, and then fundamentally also challenging, dismantling, improving the broader structural determinants of health equity. For example, food insecurity is at the individual level, food deserts at the community level, and then supermarket redlining or structural racism at the structural determinants level. In this approach, this is work that, again, resonates, I think, with all of us. We have the privilege of working with many partners. Many of you we also recognize are embedded in work that, whether you frame it this way or not, we see many of you as colleagues in this space. The framing for today, as I kind of tee up our first presenter, the reason that we decided to even host this was because in our dialogues, in our conversations with our partners, including members of our own team, my colleagues, including those on the line today and others, we recognize that as with last year, this year as well has presented challenges, not just the challenges that we of course attend to in our day-to-day work and our professional lives, the challenges of injustice, the challenges of deep inequity, including racial inequity and racial injustice, the challenges of the pandemic and what it means to be able to mobilize support, especially as we recognize now in the US at least, we've crossed a horrific milestone of 800,000 lives lost since the beginning of this pandemic. The work of attending to those challenges obviously is the work. And the work that is implicit that we sometimes don't acknowledge and perhaps attend to is importantly, is the work of ensuring that we as individuals, as teams, as colleagues, as a collective are able to care for each other on this path. To really kind of illustrate this, I wanted to share these two quotes on the slide that you see here. One is this quote that many of you are probably familiar with from Audre Lorde. Caring for myself is not self-indulgence, as she said, it is self-preservation. And that is an act of political warfare. That has rung true for many years, and especially in the past 2 years for many of us. This notion that self-care is not just a vital act of self-preservation, but it is therefore an act of political warfare, a political statement, a political act, because of the nature of the injustices that we seek to fight and the fact that they are deeply structural. There's another quote that I came across that I wanted to share from perhaps a lesser known but equally kind of provocative thought leader that I've come across just recently in preparing for today's webinar. And I'm not precisely sure of the pronunciation, but I'll try to say Omotoyo Jola Osho. This quote, self-care is not just about the occasional retreat following or in anticipation of breakdown. It's constructing spaces and communities of resistance where there is communion, solace, solstice, and rest, where we never run out of arms reaching out to hold us in recognition and warm embrace. I wanted to share this in part because self-care, even Audre Lorde's incredible quote shared over a few decades ago now, we want to recognize that self-care as a term has in the mainstream been co-opted to reflect some sort of commoditized, atomized view of self-care, as if we as individuals are only important to take care of the lowercase self, the ego, the people, that the person of myself and nothing else. As if self-care is not dependent upon, interdependent, with the care and the emotional state, the psychological well-being of others. This quote on the bottom, I think, reminds us that self-care is, with the uppercase self, S, right, is something that is not just done in isolation. If we understand the way that justice works, it's something that must be done in communion, in collective, and as this author wrote, in communities of resistance. So it's these notions that have brought forward the conversation today. And before I do any more to set the table, let's actually jump right into the main conversation. What you're going to hear now is something that I found incredibly enlightening and useful in my own work, and something that we're looking to emulate at Health Begins in our interactions internally as well as with our colleagues. And that's the work that Taylor is going to present. So Taylor, please take it away.
Thank you, Rishi. Hi, everyone. Good morning and good afternoon. My name is Taylor Goyette-Frechette. I'm calling in from Mass General Brigham in Boston. Nice to be with you all today. And I just wanted to start off with using the tool that I'm going to talk more about. And so I invite you all to do some self-reflection right now and think about your own energy. And the tool is called the window of tolerance. And you see that one in the middle of the window, that dotted line, that just means you're perfectly in control of your thoughts and emotions, you're regulated, you're cool, calm, collected. And the higher you go in the window, all the way up to +10, your energy is just going up. Maybe you drink too much coffee. Maybe like me, you're running from meeting back to back to back, and your energy is going up, right? Maybe you're feeling anxious, but really it's about where your energy is. And then as you go below 1, all the way to -10, your energy is just going low. So maybe you didn't get a good night's sleep, or maybe you're really just dreading something. What's coming up next? What's the next meeting? And so I just invite you all, whatever space you're coming into, to reflect on where you are in the window. Are you feeling high? Are you hyper aroused? Are you feeling low? Are you feeling tired, like you want to shut down, like you need to disengage? Are you feeling good, calm, collected? And I invite you to just put it in the chat if you want to, or really just take a moment to acknowledge, like, wow, this is where I am right now. So if you could just put your number in the chat, I'll put mine. I am definitely coming in at a +4. And I'm already coming down in the window, being with you all. So that feels great. Thank you all. A lot of positives I'm seeing. Nobody's tired, really? There we go. I see a -2. Thank you for being honest. All right, we can go to the next slide. So I'm going to talk about the window of tolerance as a racial justice and health equity tool. And I cannot talk about this tool without first acknowledging one of my mentors, Denny Butler McKay, who is a senior clinical social worker and the co-director of racial justice and equity initiatives at the Southern Jamaica Plain Health Center in Boston. And I first learned about the window of tolerance from her through my work with the Racial Reconciliation and Healing Project, a project that her and my other mentor, Abigail Ortiz, co-developed, and they work with youth across the greater Boston area. And it really was a tool that invited feelings into the space when often both youth and adults are asked to leave emotions at the door. And it really transformed the way that we saw each other and were able to care for each other and ourselves when we were working together. And so first, it's really helpful to know like what the actual window means. Why do we want to be in the window? Above the window, so when you go above a +10, you cannot think at all, but you feel so much. And if you go below the window, below a -10, you cannot think or feel. So that you're going numb, you're shutting down. And as I said, the middle of the line, you're perfectly in control of your thoughts and emotions. The goal is to stay in the window. And the importance of this is so many times at Mass General Brigham, we just launched our United Against Racism initiative. And so many times I'm in the room talking with people about racism, about structural racism in our own healthcare system. And people are getting off camera, wanting to leave the meeting, or maybe getting really defensive. And that's because they're starting to go out of the window. And so before we even have the conversation, it's helpful first to check in where I am in the window. Am I already heightened coming into this conversation? And then asking others, where are they in the window? Because if somebody's already at a +9, maybe we need to do some work and ask what they need to get down in the window before we have the conversation. Next slide, please. And so I just wanted to offer some ways to use this tool. And these are ways that I've been using the tool at Mass General Brigham. So first of all, with your team. So every time I start a meeting, I have everyone go around and I ask, where are you in the window? So everyone coming into the meeting, I'm at a 2, I'm at a 3, I'm at a -5. Ooh, you're never at a -5. You're usually in the positives. What's going on? And then also using it to check in with colleagues one-on-one. So maybe it's not a team meeting, but I have just a one-on-one meeting with somebody. It's a way to just check in. Where are you in the window today? And maybe there's something going on that I wouldn't have known about if they didn't check in the window. And maybe that conversation can pause and wait for another time. Or maybe we just are able to connect and move on. 2, with your patients or clients. My background is in clinical social work. And I used to use this tool with my clients as well as the patients I worked with. And it really is a way to just start off the session. Where are you in the window today? And if my client or patient checks in high or really low, that's an opportunity to build trust. And it's an opportunity to check in. Why are you so high or low in the window? And sometimes, most of the time, it was because of them being anxious about being in the hospital, about an interaction they had with a doctor that wasn't great. And so that already is giving me an idea of like, wow, all right, so I'm coming as a representative of a hospital, and they see the badge, and just seeing my ID badge is making them go up in the window. What can I do? How do I position myself differently? So it really is a tool to help in terms of really building trust with clients and patients in a clinical way. And I think most importantly, which is why we're here today, is with yourself. So really doing an honest check-in with yourself. Where am I in the window today when I'm going into this meeting, this appointment, right? And also, right, using it with our families. And so sometimes I have some bonus babies at home. So sometimes when they go home from school and they're not listening, I go up in the window. And so I need to reflect on myself. Okay, I'm responding from a +9 right now. Is that really going to be helpful? Let me take myself down. Let me do some deep breaths and not respond until I'm a +5. And I say all this to say, if you can go to the next slide, self-care is racial justice and health equity work. Oftentimes in racial justice and health equity work, we are asked to put ourselves on the back burner to make things more equitable, make things safer, make things feel better for others and not ourselves. And we forget to really work on self-perseverance, right? If we're not okay, if we're burnt out, we cannot still be in the fight. And so I invite you all, the window of tolerance is definitely accessible. I invite you all to really use it, whether you're checking in with yourself or your teams, because it really is a way to help take care of each other and really identify maybe ways that we're hurting each other or being harmed by the system we're working in. And I just find it very helpful. So I'm really glad that I get to share it with you all today, and invite you all to remember that taking care of ourselves, as Audre Lorde said, as we heard the other person say, is part of our racial justice and health equity work. It's really critical. And thank you all, and I look forward to our conversation.
Taylor, thank you so much for that. I know we're going to move on to our presentations from our friends at Health Outreach Partners. And just for everybody to know, as I'm sure you are already thinking of, there's probably questions about the work that Taylor just presented, the tool. We'll have a moment after our next presenter to then enter a kind of fireside chat space. So please do, as Grace mentioned at the top, feel free to enter any questions or comments in the chat, and we'll make sure that we attend to them at the end of this next presentation. So Taylor, thank you again. And this is also a good way to introduce our next presenters here, who will bring in their own perspective. So Patty and Cindy, I'll turn it to you. Thank you so much.
Good morning. My name is Cindy Selmy, and I am from Health Outreach Partners. If we could move to the next slide. And also here today is my colleague, Patty, and we're going to present together. We're going to start this morning with a poll. We want to get a sense of the practices in your organizations and see who's here with us. So if you can take a short minute to respond to the poll. We want to know what organizational self-care practices are in your workplace, if any. We'll take about 30 seconds to answer the poll. Looks like we're getting a lot of answers. Looks like gym discounts and wellness discounts are leading the pack so far. So why don't we just take another couple seconds and then close the poll, and I'll start the presentation after we look at the results. think the poll has ended, and 28% of you say that your organization provides benefits that encourage wellness, such as discounts for gyms or wellness, followed up by 14% that leadership models self-care by setting norms and encouraging healthy practices. So thank you all. It's great to have you here today. If we could move to the next slide. My organization back in 2017, HOP, they developed as part of the Community Health Center program, a self-care resource to address staff burnout in community health centers. And I was not part of the organization at that time. I was an operations director for a large health center in the Bay Area, and I oversaw 10 clinics. I also at that time had really noticed a shift in the morale of our frontline staff. Our clinicians were burned out, our support staff were feeling burned out. The feedback we were getting was that they did not feel like they were giving our patients good quality care. We were on a downward trend. We had seen less patients year over year from 2012 through 2017 by about 5% year over year. We were seeing less patients per hour, but yet ending every day spent. I'm sorry about that. I had a technical issue. Our staff were feeling spent every day, and our leadership responded by having a retreat one day for all of the providers and the managers who worked in the health centers. And by the end of the retreat, what our charge was to create a contract with ourselves to engage in self-care activities on a daily, weekly, and monthly basis. And I came away from that noting that the onus was on the employees and the staff to do this work, but no organizational changes were taking place. And what happened after that was that burnout continued. We had turnover of providers, as well as access for our patients continued to decline. So in 2018, the National Association for Community Health Centers Needs Assessment for Training and Technical Assistance noted 2 of the 3 top needs for health centers that I'm going to discuss today. And one was support for addressing burnout and stress in health centers. 54.1% of respondents stated that that was a big need. The second big need of 59.1% was that health centers needed support to address value-based transformation. And part of value-based transformation is addressing the quadruple aim, one of which is improving provider satisfaction. And my slide shows many factors affecting negativity in providers, one of which I just want to note is around EHR. That EHR and talking to a screen leads providers to feel like they are not giving good care. And I think that we could safely say after 2 years in a pandemic that talking to a screen has also contributed to our burnout. And it has taken us as leaders to this point to see this. Next slide. So our organization this last year created the organizational self-care resource. And we had planned to do this prior to the pandemic. But in the course of the early part of 2020 and 2021, it became really clear that employers had to join forces with their teams in order to support them in creating a culture of self-care practices. And my colleague, Patty, who will speak to us in just a minute, was the author, along with another one of our colleagues, Robin Barron, of this resource. And based on the data from the needs assessment and the pandemic, we discovered how crucial it was that we move from making self-care the employee's responsibility to it being a collective responsibility led by the leaders in our organizations to support this work. Next slide. So today's webinar is called Walking the Walk, Talking the Talk. And so I had a moment to reflect where we are in this process at Health Outreach Partners. And I had been thinking about this quite a lot in the last several months and weeks. And when I joined this organization, we had a very solid self-care program for our team. We engaged daily in self-care breaks. We took walks together, shared meals. We have some days of personal leave that our staff can take to tend to their wellness that is separate from their vacation and their sick time. And when we started working remotely in March of 2020, we continued to embrace these activities as part of our self-care. And we were continuing, and as things changed around us and our environment changed and our work environment changed, and it was becoming clear that we were not going back to the way that things were prior to the COVID-19 pandemic. As an organization, we continued to pound literally the square peg into the round hole, and we're not making the changes that our team needed in order to feel cared for. It was clear that what worked before was no longer working for us, and we needed to come together and collectively make the changes so that we can address what was happening in our environment, our new environment, our ever-changing environment, as well as our new and changing staff. And I'm going to leave this presentation with a lesson that I have learned as a leader in the last several months, particularly this summer, that this is a fluid and ongoing process, and it needs to be the priority of leadership to nurture this process, and that culture change is continuous and that it's never done, and to take a step back and invite your team to the table and look at your practices and make the changes so that they are cared for in this environment and in the times to come. And with that, I am going to introduce my colleague, Patricia Avila Garcia, a project manager at HOP, who is responsible for our resource. Patty.
Thank you, Cindy. Like Cindy said, my name is Patricia Avila Garcia. I'm a project manager with Health Outreach Partners, and I am excited to share a quick overview of our resource with you all today. And I do invite you to visit our website at the link provided in the chat to access our resource. I want to start by sharing our definition of organizational self-care at Health Outreach Partners. So we define organizational self-care as a broad organizational approach to foster a healthy and supportive work culture and environment. And it aims to reduce burnout and compassion fatigue, improve job satisfaction, and encourage the growth of staff and the organization. And so how can organizations start to build a culture of self-care? In our resource, we outline 4 main steps or components that are crucial to starting this journey. And the first is to conduct an internal assessment of the current self-care policies and practices that already exist at your organization. And a really important component of this step is that it involves all staff at all levels of the organization, not just management, not just leadership. And this is a process to obtain feedback about what are the practices that are in place. These could be written policies or unwritten policies of how work is done in your organization. And after having involved staff at all levels of the organization, at this point, hopefully you've collected both qualitative, quantitative, administrative data. And the next step really is to take a look at that information that you've gathered and identify the themes, strengths, and opportunities that are surfacing. The third component that we outline in our resource is to find a way to share the results of your assessment with all staff, and then really invite everyone to participate in this process. And the fourth step that we outline is walking the walk, right? After you've taken a look internally at your processes, you've received feedback, and you've made it an intention to include everyone who's a stakeholder, which is all of your employees. It's time to commit time and resources to creating the change within your organization. And in the resource, we talk a little bit more extensively about some strategies and tools to be able to go through this process. And just to highlight some guiding questions that we think are important to ask yourself and ask your team in this process would be reflecting on what would be different if we had a sustainable and equitable culture of self-care, or what would you be doing more of or less of if this vision of collective, equitable organizational self-care became a reality at your organization. Next slide. And in creating this resource, our goal was to have special consideration of Black, Indigenous, and other people of color in the workplace. Our organization works with community health centers, and we know that community health center staff in all roles, clinical, non-clinical, community health workers, they all play a crucial role in working towards health equity. But we also know that staff working in community settings are more likely to share one or more identities with the communities that they work in and that they serve. And that they also experience the marginalization in society and in the workplace that they're hoping to address through their work in healthcare, racial equity, and social justice. And so we wanted to be intentional about equity and how it can be achieved in this process. So there are three frameworks or approaches that we highlight in our resource. And I'll just go through them quickly here, and you can find more details in our resource. But the first is applying an intersectional lens to this journey of creating a culture of organizational self-care. And I want to credit where the term intersectionality comes from, Kimberly Williams Crenshaw, a legal scholar. And it helps us understand that people experience multiple forms of oppression based on multiple intersecting identities. And applying an intersectional lens at your organization should include asking some really important and crucial questions. For example, does your organization have clear and measurable goals related to anti-racism and reducing racial disparities in the workplace? And are there policies to address the ways that women, non-able-bodied, and LGBTQ+ and other underrepresented identities are included in the decision-making process at your organization? The second framework or approach that we really highlight in this journey is using what is called a healing-centered engagement framework. And this can be seen as an expansion of trauma-informed care. Again, to credit Dr. Sean Ginwright, who is a professor of Africana Studies at the San Francisco State University. And in summary, a healing-centered approach intentionally centers not only the well-being of patients or clients that we serve, but also of the workers themselves. And to highlight the third important approach that we advocate for in this journey is really leveraging partnerships. And this involves both internally across departments, across teams in your organization, and externally. And this can look a lot of different ways, but it's really about identifying your strengths and your opportunities and bringing in folks both from inside your organization or outside your organization who really can complement the strengths that you have to be able to implement the plan that you have created. And I want to just say that these are the highlights of some of the things that are in the resource. Our resource is meant to be a launching point for organizations to start their journey. And we recognize that not all organizations will have the same journey. Some of them are in different places along that in recognizing how they provide self-care for their employees and what they could be doing better. And so our resource provides some approaches and some tools so that folks can think about how to create an organizational self-care practice that is sustainable and equitable. And again, our resource is available for anyone who would like to download it at our website. Thank you. And so I will now hand it back to Rishi.
Patricia and Cindy, thank you. And Taylor, thank you as well earlier. I'm going to bring us over into the fireside chat moment and stop sharing the screen here so we can now have about 20 minutes, I hope, of some dialogue before we wrap today. My gratitude to all of you for just sharing the work, some of the tools. And let me, I think what we're already seeing, especially with what you each have presented, is that there are actions, there's levels of agency as individuals, as professionals in our environments, but even, as people, in our own homes and families. Taylor, as you kind of nicely spoke to, in the way we interact with people around us, the people we serve, the people we work with. And then there's levels of agency as we think about how we collectively in our teams, in our institutions, start to create the environments, right, to support not just individual self-care, but this type of care for each other. So I really appreciate the framing, and I'll follow that to maybe go, Taylor, to you first and go to Cindy and Patty. When it comes to the individual level, let's unpack some of the opportunities as well as some of the lessons or the challenges you've come across in terms of this work. So Taylor, first to you. When you use the window of tolerance, you mentioned this briefly, there's some history here that I think you spoke to. Obviously, you paid homage to who you learned it from and that kind of lineage of people who had shared it and used it. What I know is that what I've come across, at least as I've learned about this tool, as you shared and others, is that it comes from the world of therapy and helping individuals deal with trauma. And there's something really meaningful, compelling about the fact that this is now a tool being used to, in some ways, address the collective trauma of whether it's racial injustice or the other traumas that the last 2 years have really magnified or made obvious. So I'm just curious if you want to speak to that history more, and then within that, as people dial in either at a way high on the window or way low on the window, could you just give us an example a little bit more about what you do? What are some of the tips that you recommend people use to be able to help somebody who's out of the window to kind of support them to get back in?
Absolutely. Yeah. So it was definitely developed as a clinical tool to use in therapy. But as you mentioned, oftentimes when we think about trauma, we think about you have to go to therapy, you have to do talk therapy, you have to be an expert, you have to be a social worker. But really, we're experiencing trauma every day. Like you said, in the COVID-19 pandemic, racism is trauma, other systems of oppression are trauma that we hold in our bodies. Systems, right, perpetuate trauma, healthcare systems do. So, and we see the outcomes, right, in health inequities. And so you mentioned when you're really high or really low in the window, being able to identify that for yourself, one, that can help get you regulated. So just being able to say, I'm an 8 in the window. Wait, my number's going down now because I was holding how I was feeling. And oftentimes we're asked, right, be professional. leave emotions at the door, where we have to hold whatever we're carrying in the room. Or what in the COVID-19 pandemic, like holding patients, our patients dying, holding, you know, all these crises, and we're never able to just name what we're feeling. So that's one. And two, when we're high in the window, things like take a deep breath, go for a walk, drink some water. When we're low in the window, maybe it is right now we're not going to engage in maybe giving that person permission to step away to get themselves back in the window. But I think it's every individual knows or has an idea of what works and maybe what doesn't work. And I don't want to say the same things work for everyone, but if you think about when you're the most high in the window, the most anxious, the most you're feeling and you're no longer thinking, what are the things that bring you down? Sometimes it's only that one person that will bring you down in the window. So the tool also invites people to think about that so they can regulate themselves.
Mm-hmm. And Taylor, I'll just, and for Cindy and Patricia as well, just draw everybody's attention to some of the great comments coming in the chat, encourage everybody to kind of do the same. So Michelle, thank you for your question in the chat, and Kristen as well. So I'll elevate this question and maybe turn it to Patricia and to Cindy. As we promote self-care and begin culture change, we're encountering a range of emotions from staff, and from excitement to anger and pain. Given the trauma, how do you recommend we best prepare for and work with staff giving back anger and pain to the team promoting these messages? I think Kristen's question is a profound one, and Michelle's question as well, about what are some of the most effective measures you recommend to measure an inclusive self-care culture. I think these two things, maybe I'll go Patricia first to you, and then we can come back to Cindy and Taylor.
Thank you. Yeah, both great questions. I think for me, I can address some of the ideas I have for the measures that you can use for inclusive self-care. I think there's a lot of defining that needs to happen. So what do you mean by inclusive? What is important for your organization? And having a definition of inclusivity. So again, we are talking about intersecting identities, but also different roles and acknowledging the hierarchies that exist within organizations. And so some of the concrete measures could be things like if you're having these meetings around organizational self-care processes, who is at the meetings? When are they being held? Are they inclusive of different primary languages of staff that are at your organization? And are you creating spaces that have ground rules that enable all staff to bring their perspectives? And, to take it even further, when you have a list of kind of processes or policies in place, like some organizations offer wellness activities like yoga or meditation, but we've done a survey through our work, and one of the feedback points that we got was that a lot of staff aren't able to attend because their workload is just too heavy. And so what are the practice, and some of those titles of the folks who aren't able to attend are lower on the organizational hierarchy. So what are really the, again, what's the definition of inclusivity that's important to you at your organization? And what are all the different ways that folks of different identities, of different roles may unintentionally be excluded? And how can you start to quantify or gather more data around that? I think that would be where I would start. Mm-hmm.
Cindy and Taylor, as we go to you, thank you, Patricia, for that, because I think one of the things you unlocked earlier in your comments, and as did others, but what you just picked up again is there are institutional enablers or barriers, right, to self-care, and some of them are not just in the domain of wellness or self-care. Some of them are just pay equity, workload expectations, the nature of the work. There's other stuff baked into the nature of institutions that themselves can be toxic, not just to the beneficiaries of the services, but to the people delivering them. I want to spend a minute on that because of the concern I had flagged earlier, I think each of you have spoken to, and that is that self-care, especially in this context in a country that has done such a good job at commoditizing self-care, at atomizing it. It's not as if self-care is some sort of a thing that can just be put on, Cindy, as you said, on the backs of an individual person to say, now go, practice yoga for 5 minutes and you're good. There's something about the enabling environment that I'm curious if you could speak to, and Taylor as well, please. So brief comments from Cindy, and then we'll go to Taylor as well for quick comments.
Yeah, thank you. It is a really important point that I think that what I have started to do in my organization is to really look at and define like what is an appropriate amount of workload, because as Patty said, that some people in some organizations and some jobs don't have the time or the opportunity to go practice yoga for 5 minutes or 15 minutes, or even when at HOP we would take our 15-minute meditation break. I mean, that's really important, but it's not the whole story. When we leave the office and we are carrying an untenable workload with us, then we are not really practicing organizational self-care. And looking at what our expectations are for our team and for ourselves, and what the practices that we can do in our flow of work to support self-care is equally as important as the extra activities that we take on to feel better. And I feel like as a leader of an organization, that is a very pivotal place to start. It's like, what are we asking our team to do, and what is an appropriate amount of work that we expect? I just have one other thing that I would like to say that is really important for self-care that you brought up to us in our planning, Rishi, and that is that primary care and being able to access primary care as human beings is also part of our self-care. And I think organizations have a responsibility to provide benefits so that their employees can access primary care and could tend to their health, as well as give them time throughout the business day to be able to access those services.
Yeah. Taylor, anything you want to add to what we've shared so far, or anything else that you wanted to highlight in particular that hasn't been addressed so far?
Yeah, so the question in the chat, thanks, Kristen, that I know it's hard, I think, when an organization that has harmed you or hasn't prioritized your self-care is suddenly like, taking care of yourself is important. And so I guess to answer that question is, the first thing you should do is validate them. If people are coming with anger or pushback or whatever, that anything else besides embrace, just validate it, because I think that it's real. It's real to their experience. And so in order to build a culture around self-care, you first need to acknowledge that people aren't able or weren't able to prioritize self-care before. And so why should they trust the organization preventing them from doing that to now tell them to do it? So just like, remember, like, and that also helps people, right? Going back to the window, to get people in the window, like they're not so defensive. It's like, I see you, I hear you, and you're absolutely right. And this is where we want to move. So I just wanted to highlight that, like making sure you're validating folks' experiences because they're real.
I'll raise something that I think is topical for everybody here. We're in the middle of the Great Resignation, as Michelle rightly points out. Short-staffed everywhere. Workload is impossible to balance just because of the nature of seems like the work these days. Any recommendations? Small, short question, big topic, and obviously apropos for what we're talking about today. Curious if anyone of you want to step in to answer first. I have some thoughts I'm happy to share. It's a jump ball question.
I think that it's a hard question, and I don't want to claim to have all the answers or even any of them, to be honest. But I do think just acknowledging that we have an impossible amount of work to do and very limited time, and to we don't have to take everything on. I think that is a message that we don't often share with ourselves personally. I think we think that we have to do it all, and we're kind of coming out of several decades where the expectation was that we do everything, that we're parents and partners and siblings and family members, and that we just will take endless work on, and that we can't do everything, and we have to really set limits. And as someone in a leadership role, I have in recent months had to not take on projects because we didn't have the staff to do that. And it's hard to do that. But it is a reality that it's just, we have very limited capacity, and we have to be able to only accept what we have the capacity to fulfill.
Taylor and Patricia, there's some additional questions coming in, and I appreciate this as we look at the last few minutes together today. For example, Lydia's question: are there any examples of policies that validate and encourage staff to take time for individual practices and building community among teams? I'll share a couple, and this is drawing from my own experience, and I think this also touches on, I think, Cindy, your comment also touches on Anne Renee's comment. I want to honor that as well, about the fact that there's this perception sometimes, especially among clinical staff, to layer on more work, right? That more, this perception of duty, right? That compels you to care, even if in some cases you're not only given time off, but even getting pay. There's many who in the pandemic who've worked without pay, right? To care, literally to save lives of others. So I want to honor that comment for sure. We have I think, Catherine, I think you put it nicely, that part of this shift, it looks like it's shifting to honoring that high performance means self-care. And I would even go so far as to add to that, Catherine, and say yes, and to that, building what we've learned from our guests today, that self-care is also not just an individual activity, it's a collective process. That self-care is necessary, but not sufficient. We have to also create collective care and embed that as part of an expectation of high performance culture. Some policies, for example, that we've tried to emulate at Health Begins, and that we're seeing, learning from a lot of peers in the space, and always pushing ourselves to learn about, is every other Friday off, paid time off. The work week itself is something that has, there's a lot of history behind the nature of the work week and the certain kind of expectations of quote unquote productivity. What that means, there are expectations that we're trying to balance a little bit by making sure that people equate productivity with work done rather than hours worked. And so every other Friday off is something that we've implemented for over a year and a half. Other institutional policies, for example, include, I think, Cindy, what you mentioned, and I think others are doing as well. Beyond paid time off for sick leave or vacation, how do you actually create personal leave time, and let that be time that individuals can use to just flag and say, I need time for my own mental health, my own kind of self-care. There's more and more organizations that are recognizing the importance of doing that. And I think that is particularly these policies, whether it's those or any other examples that Taylor or Cindy, Patricia, you want to share, these institutional policies are going to be especially important because of the Great Resignation. Michelle, as you pointed out in your chat as well, part of the reason for the Great Resignation is that, I think, of the economic drivers, but also the fact that people are realizing in this market where there's more demand for labor, there's a lot more opportunity now for people who provide labor to essentially find workplaces that align with the best of what they want to be with their full selves and honor them. And so if your institution doesn't have policies, as it looks like 23%, based on the poll that we shared earlier, 23%, almost a quarter, had said that your organization has no self-care practices. For leadership, as a leader myself of a small organization, that's scary, right? If you don't have self-care practices, you're likely not to do a good job as a leader of an organization to continue to attract the kind of incredible talent that you need to be able to fulfill your mission or your business objectives. So there are a lot of institutional policies. I'm curious, Taylor, and then maybe Patricia and Cindy in that order, if you want to just identify any other institutional policies that create these environments where the window of tolerance becomes a norm, where other institutional policies, other self-care, collective care processes are baked in and standard. Taylor, you want to go first?
Yeah, I actually don't have any good examples of policies, which I feel like is probably common for folks. I think the fact that we're talking about policy, though, is right where we should be, because just focusing on the individual, right, and expecting them to take care of themselves isn't fair in the context of white supremacy, patriarchy, and capitalism, which create the conditions, right? In a healthcare system that's driven by capitalism and where your value is put into how much you work and how much money you produce, where's the value on self-care? And so I just wanted to acknowledge that in this discussion. And when it's around white supremacy, patriarchy, and capitalism, it's really hard. It can be really challenging to create policies that go against any of those in healthcare. So I'd love to hear from Cynthia and Patricia if you have any examples in your organization, because I do know it's a challenge.
Really quickly, Cynthia and Pat, if you don't mind, because I also want to call on a friend who I just saw come off camera to share, because I think Dr. Tony Lewis probably has some suggestions too. Cindy and Patty, really quick.
I'll just say that at Health Outreach Partners, something that I'm really grateful for is that our office will close for the holiday week, which allows us to have time with the folks we want to spend the holidays with without worrying that it will interrupt our workflow or our, because everybody will have it off. So I'll just say that is one example.
I love that. Plus one to that as well. We do that at Health Begins, and want to encourage everybody to do at least that. Cindy, really quick, any additional comments?
A policy that we have also at Health Outreach Partners, which has been hard to do during the pandemic though, is we give our team time off every week, 1 half day, to go do volunteer work for an organization or something they're passionate about to feed their soul. And I do know that's hard during this time, but it is something that I still encourage and partake in myself.
Thanks, Cindy. Thank you. Tony, it's so good to see you. I'm going to ask you maybe 30, 60 seconds at most, if you don't mind. It's not nearly enough for a friend from long ago, but Tony, thanks. Do you want to?
Sure. I've popped some things in the chat, and it's really good to be here. I'll say first time. Dr. Brittany Cooper always talks about how, like, one of the things that racism takes away from people of color, Black folks, queer folks, is time. So any way you can give that back or create space is important. And also thinking about racism, equity, and labor. Anything that's requiring additional labor from folks to get their self-care is kind of in sync with the extractive economy. So for Black women, if we think about our equity kind of conversation where we're talking about maternal mortality and how much grief we're experiencing, think of that in terms of the people that you're working with, and provide more space, time, resource, and labor and autonomy without asking people to give away. The last thing I'm gonna say is I did provide them on faculty at IHI for some things, and there's a great resource on how to have conversations on staff well-being. And what we've done at Liberation Health Strategies is surveyed a bunch of organizations to ask staff, which of these things would you like your organization to invest in order to create the best space for self-care? Because it can differ from organization to organization. And as a companion to kind of this, do you want to hear me, protect me, prepare me, support me, care for me? There's an actual piece that has a list of policy recommendations for each of those things, should the staff care for it. But ask, provide time, create space, and I'll just go back to my doctor, do no harm, right? Start there with the self-care piece, right? So that's all I got today, Rishi.
All you got is enough for a lifetime for a lot of us. So thank you. Taylor, Cynthia, Patricia, and Tony as well. Thank you all. an hour has gone by right now, but I will say I feel more in the window than I did before this conversation. And I'm hoping for all of you as well that you're seeing that this conversation, at the very least, honors, elevates, and centers the need to make sure that we care for ourselves and each other on this path to equity. If you have additional ideas, comments, questions, or even resources yourselves, please stay in touch with us. You'll see a follow-up survey show up in a minute. Please take that, share any insights and actions. You can use our Twitter handles or email us. Take action in the follow-up email you will receive. You'll see some of the resources that were shared today, including what Tony and Taylor and Cindy and Patricia shared. And then, of course, as always, stay engaged. Thank you deeply. All our best to you, your loved ones, and all those that you care for and care about. Be well.